PCOS is a lifestyle disorder, and PCOS treatment is a fine blend of lifestyle modification, drug treatment, exercise, and important supplements. So hello everyone, this is Dr. Pragya Gupta, practicing obstetrician and gynecologist. So here we are going to discuss some important supplements that can be used in the treatment for PCOS. So these supplements can be vitamins, trace elements or minerals, some herbs. So these supplements are actually very strong antioxidants. They decrease insulin resistance. They also are anti-inflammatory and they also help in weight loss. But a strong word of caution before I start this video is that these supplements should only be used after you consult a doctor, because some of these supplements are not FDA approved. In fact, we are going to discuss some of the local herbs which have shown improvement in the symptoms of PCOS, but there are no strong studies or evidences that can prove that these are actually important for curing PCOS. So first supplement is inositol. So inositol is one of the most common supplements that we doctors use in the treatment of PCOS. It is responsible for decreasing insulin resistance, decreasing testosterone. It also controls the blood sugar levels and also is very important in inducing ovulation, especially in infertile patients. A lot of food products like nuts, legumes and green vegetables have inositol. Apart from this, the second most important supplement is chromium. Chromium again is very important in decreasing insulin resistance. It is responsible for decreasing androgen in the bloodstream, and also it is very important in decreasing the adrenal fatigue that PCOS patients face, and therefore very important for period regulation. Again, nuts, the legumes are very high in chromium. We often advise iron studies in PCOS patient. Because of heavy menstrual bleeding, these patients bleed and land up into anemia. Therefore, it is important that you get good iron supplements. Whenever you visit your doctor gets a CBC or complete blood picture done and advises iron supplements depending upon your hemoglobin level. Apart from the supplements, there are a lot of food items available which is in your own kitchen that can increase the iron levels in your blood, like jaggery, your nuts, green vegetables like spinach, kale, broccoli, methi, even moringa increases iron in your bloodstream. One important tip that I can give you is to cook your food in iron utensils, which will keep your iron levels at check. Again, an important supplement is zinc, which is a trace element. Zinc not only improves the immunity of a patient, but decreases the insulin resistance, decreases testosterone level, again which is responsible for a lot of acne and unwanted hair. Zinc is a very important supplement in all the dermatological creams that we use. So again, the zinc helps in treatment of acne pores that the patient gets because of PCOS. Apart from this, zinc is again very important in ovulation, and it is often given in the patients who suffer from infertility with PCOS. It improves the egg quality, it improves the ovulation tendencies of the egg, which become very less in PCOS patients. So these zinc supplements are important, and zinc is also present in a lot of food items like your nuts, almonds, your cashew nuts, your walnuts. Apart from that, a lot of grains have zinc too, and the fruits, especially citrus fruits, have zinc in them. So vitamin D is called the fuel for ovaries. And in PCOS, vitamin D is very less. Around 85% patients with PCOS suffer from vitamin D deficiency. Now, vitamin D is very important for ovulation, for period regularities, for creating an anti-inflammatory state in the body. So whenever the vitamin D is decreased, It first of all causes infertility, it causes period problems. It also causes lot of increase in testosterone level, which again is the root cause for a lot of other problems like hair growth, as we've discussed, pimples, acne. Again, vitamin D supplementation is very important, and vitamin D is not freely present in a lot of food items. Apart from supplementation, you need to understand you need to have a good sunlight exposure for vitamin D process and synthesis in your body. There are medicines used in PCOS like metformin, OCPs or the hormonal pills, which decrease vitamin B levels in the blood. Again, you cannot replace these medicines, but you need to increase the level of vitamin B in your body, because vitamin B is very important for insulin resistance, for decreasing the inflammatory state in the body. Vitamin B like B12, folate, B6 are very important for a PCOS patient especially. So vitamin B levels decreases homocysteine level in the blood, and they increase the reproductive capacity of the ovaries. So vitamin B deficiency should be tackled very efficiently, especially in patients of PCOS. Lot of food items with it, again your nuts, green leafy vegetables. By taking these, you can again cater with the B12 deficiency. Probiotics play a very important role. Often people ask, ma'am, probiotic is for the gut health. How can it affect your ovarian health? So gut is our second brain, and the gut health influences the overall health of a body. So whenever we give all the supplements to a PCOS patient, or for that matter any patient, we always add a probiotic, because gut health is again very important and essential part of our treatment. In fact, a good gut health improves insulin resistance and also decreases the inflammatory state. So a lot of PCOS patients suffer from gluten sensitivity, and improving gut health by adding probiotics actually relieves gluten sensitivity and also inflammatory state in the body, which is developed by taking gluten. So probiotics like curds, yogurts are very important for a PCOS patient and should be added in the diet. So again, magnesium is one such supplement which improves the period health and ovulation, and it is very important for the muscle growth also, and it caters the fatigueness that a PCOS patient faces. And also one of the important symptoms of PCOS, as I've already discussed, is adrenal fatigue. So magnesium again is an important supplement that caters to that kind of fatigue. It is present in a lot of food items like legumes, your nuts, a lot of fruits also like bananas contain magnesium. So we can add all this in our daily life to cater the deficiency of magnesium. Omega-3 fatty acids, again a very important supplement for PCOS, which decreases inflammation. It also helps in decreasing cholesterol. One of the important functions of omega-3 fatty acid is decrease in leptin levels. Now, what is leptin? Leptin is a hormone which is responsible for increased hunger in a patient. So, in PCOS patient, leptin levels are quite high, which is responsible for a lot of sugar cravings, snacking problems, midnight snacking, and this is responsible for increased weight gain, increased peripheral fat. So, omega-3 fatty acid actually decreases the leptin level and is very important and given in patients of PCOS. Evening primrose oil, again very important for decreasing inflammation. It improves the pain in the periods that PCOS patient faces. It increases in ovulation. So again, infertile patients with PCOS are often given evening primrose oil. Apart from this, supplements like berberine, L-carnitine are the new kind of supplements. The researchers have shown that these supplements are actually very important in decreasing the level of insulin and have caused remarkable weight loss also in the patients of PCOS. So again, there are a number of herbs, as I've already discussed, which are responsible for decreasing the symptoms of PCOS. But again, a very concrete study or evidences have not come up with these herbs. So some of them are cinnamon, your turmeric, ashwagandha, shatavari, mulethi, moringa. These have shown to decrease inflammation in the patients of PCOS. But again, a word of caution, you cannot use them without the consult of your doctor. So carrying on the series of PCOS, we would be discussing more on this topic in the coming videos. So I hope you like this information, and do subscribe my channel for more such information, and share this information to those who are at the utmost need for it.